On the subjective examination, patient is propped up on the bed, and I'm observing patient's respiratory techniques. It's indicating that patient is having labored breathing, and he's also using his thoracic muscles, accessory muscles of breathing, which also indicates hyperinflation. Above that, and the abdominal movement is not really well. It's not having much of abdominal breathing. The diaphragm is not. He's not using much of his diaphragm to breathe. So these are the things I've observed from the patient. Um, uh, I've also taken an idea of patient's blood pressure and confirming that patient is hypertensive. And the oxygen saturation that I just obtained also shows that patient has a 93% oxygen saturation. So after the observation, and I will proceed to auscultation to check for breath sounds. I'll I'll use this stethoscope to check your chest to also ensure that to check your air entry into your lungs. Do you mind?
Okay.
Um, I'll be doing it onto your skin, so I'll be taking your clothes off a little bit. So I'll give you directions to breathe in, take a deep breath in, and then out. So you will go when I ask you to. Can you look this way a little bit? Thank you very much. Let me know when you get tired. Okay, so I'm checking the upper lungs now. Can you take a deep breath in? Out. Good. In again. Out. Okay. Take a deep breath again in. Out. Good. In again. Out. And now I'm at the middle lung zone now. Take a deep breath again in. Out. Deep breath again in. Out. Okay. Go in again in. Out. Deep breath again in. Out. Take a deep breath again in. Out. In again in. Out. Are you tired? Okay. Do you mind leaning forward a little bit for me? And maybe holding on to your knee a little bit forward. Thank you very much. I'll take your clothes off and check your lung zones and your back. Okay. Thank you. Now take a deep breath in. Out. In again. Out. Deep breath in. Out. In again. Out. Deep breath again in. Good. Out. In again. Out. Good. In again. Out. In again. Out. Thank you very much. You lie back completely. Good. Okay. Now I will be checking the expansion of your thoracic expansion. I will be placing my hands holding on to your basal lung, and I'll ask you to take a deep breath in and out. Okay? Do you wanna go? Are you tired? Do you wanna have some rest? Okay. Are you ready?
Yes.
Alright. Let's go. Deep breath in. Out. Good. Can you try breathing from your abdomen? When I say deep breath, try to push your tummy out and then in. Let's go. Deep breath in. Good. And out. In again. Good. Out. Good. All right. So now, can you cough for me? Okay. Are you coughing out anything? Are you coughing out any phlegm? Okay. So I'll get you something to put it in. Okay. Okay. All right. Afterwards, how do you feel now?
Tired.
Tired a little bit? Do you think you've got enough energy to walk at home when you walking? Do you use any walking aid? you can walk on your own without any aid? Do you kind of hold on to the furniture, or can you walk really well
When I'm tired, I hold.
onto the furniture?
Yes.
Okay, so I just want to check the strength in your legs before that. Can you just push your leg up for me? Up against my hand. Push up, push up. Okay, and that one, push up, up for me. Up. Good, good. You've got enough strength in your leg. Alright, so I'll pop the blood pressure machine on again just to have a look on your blood pressure when you're standing up and going down, just to make sure that you're not having any high blood pressure when we're doing that. So I'll pop this on again, and I will also pop the pulse oximeter on, see how it's going. Okay. Do you mind? Can you come down from the bed?
Okay.
Okay. I'll give you a hand. Good. How do you feel?
Alright.
Any dizziness?
A little bit.
A little bit? Okay. Can you just touch the floor? Feet on the floor. Good. How do you feel?
Okay.
You feel okay? Any dizziness? Okay, good. How do you feel? Can you stand up? Good. You alright?
Yes.
Any dizziness? No dizziness? Okay. Any pain? Okay, I'll take this off. I just want you to take. Huh? Okay.